Hello everybody, Suzanne Connor Singh from Dying Visual Hypnosis for Reclaim Your Practice in Your Life. And today I would like to speak about something that is, well, very close to my heart and my mind, and that has to do with how we go about helping our clients and patients heal. You see, there were years, many years, when I myself was a psychiatric patient to a very lovely psychiatrist who did the best that she could to help me out. And she did do a lovely job. However, she never really got to the cause of the problem, and she never really healed the problem with me, because obviously it's up to me to heal it. All she can do is facilitate it to the best she can with the tools and techniques that she had available to her at the time. However, the paradigm of pathology, of normal emotional response, meaning that everything needs to be labeled and everything needs to be medicated, is ridiculous. And it causes a lot of problems where your patients are concerned because there's a stigma attached to those labels. Some of them love their labels. Their labels give them a reason to not do the things they don't want to do. It's an excuse. It's a built-in excuse. And other people, well, they despise the labels because they see them as limiting them. And they do limit them. Even when you go into a doctor's appointment for something that has nothing to do with mental health, once they understand you have some label on you, you're treated differently. I know, because it happened to me when I was having gynecological problems due to menopause, where the residents were treating me for something that wasn't even an issue in my life any longer for years, because it was in my history. And they made my life miserable as a result. So let us think about this a little bit differently. How about we decide that we don't need to label our patients? And how about we make it fun to heal? Because healing can be fun. It doesn't have to be just stressful, it doesn't have to be limiting, and it doesn't have to be anything other than expansive and give hope. But it comes from we, the practitioners, and how we bring about what it is that we're there to help our clients and patients do. You see, one of the reasons I was so attracted to hypnotism and neurolinguistic programming was because it's all about fun. Because all change, behavior, and learning happens so much quicker when we're having fun. So if you ever watch some of the really great hypnotists out there, Don Martin comes to mind off the top of my head as one of the more goofier folks. He loved working with children because he could bring out his goofy, energized self and play with them to the point where they let go of their problems. Gee, what a way to let go of a problem, having fun as you're doing it. And I tell my clients, my prospective clients, that I would much rather have fun with them and helping them let go of their issues and to see the, well, childlike way that we interpret things when we're children, and from the adult vantage point, we can let it go instantaneously, if we so choose, by reframing what actually happened from the adult perspective. Something a child of 0 to 7 years old is incapable of doing because their prefrontal cortex is not fully developed. They can't reason, rationalize, or judge what other people are doing. Most of them are really egocentric. That's how kids are. It is the way they are created until they develop their mental abilities to do otherwise, which brings on more emotional maturity as well. So let us understand that we can make healing fun, and we can have it be full of hope. Because you see, my goal with my clients is to help them make their dreams come true by letting go of all that which is not serving them and reframing it in their subconscious mind, the part of the mind that drives them in the first place, to something that serves them well. And none of this needs to take many hours, weeks, months, years, or decades to happen. Most of my clients, regardless of how traumatic their experience may have been, can be cleared in a matter of a few days. Sure, the sessions are longer, a few hours, generally speaking, but it's a few days. And the value that you give to a person to let go of this crap that's been making their lives miserable, it's priceless. So you charge accordingly. Because those people who get it, and the ones who don't, won't. So shift the manner in which you are thinking about the frame you are using in terms of your healing. And use techniques that actually work. And I'm going to tell you right here, right now, as an ex-patient for, 14 years, a psychiatric and psychological conventional way of healing, and that of hypnosis NLP, it's a no-brainer. So, it's obviously up to you how you choose to run your practice and the tools and techniques you decide to integrate into the work that you do. However, this is my main question. Did you get into this profession to help people heal? Or did you get into this profession to keep yourself fully booked with appointments? And an hourly pay scale, which will never do it. Not really. Because you only have so much time to see so many patients, especially when you have those who don't show. You can bring in the small claims court and do all kinds of stuff to try to get money out of them, but if they're not paying, generally they're not paying, and that's the end of the story. So, a new thought for you to think about. As always, I thank you for spending your time with me, watching this video, and I truly hope you gained some very interesting and thought-provoking ideas from it. Till next time.